This is One on One. We're pleased to welcome Mr. Patrick R. Young, President, Population Health, Hackensack Meridian Health. Good to see you, Pat.
Good to see you. How are you?
I'm doing great. You are one of the nation's top experts when it comes to this thing called population health. This is part of our ongoing series on the future of healthcare. How are they tied together?
Well, I think...
What is it, by the way?
What is population health? Well, population health is when you take a look at a grouping of individuals together and try to see if there's commonalities about those individuals, and then how can you use data to improve the quality of care and lower the costs of those individuals. So example is that, you can look at a population that doesn't have any signs of diabetes, but there will be indications that they could be what's called a rising risk. So if by getting that information, you can start to manage that population. Or by using data analytics and algorithms, you can identify potential serious illnesses that haven't necessarily manifested themselves, but you can see that there's warning signs. And you use that data, and then you use care coordinators who intervene, working with the local primary care physicians or specialists to help manage the care better.
Pat, doesn't that require being, quote, out in the community to do that?
It does. So we actually have care coordinators who are out in the physician practices who help the physician manage the care of those patients that are under our organization.
I'm curious about this. I've known your organization for a long time. I've done some leadership development there.
Absolutely.
And we talk about some communication issues sometimes. Why am I raising this? Because it strikes me that as I talk to clinicians and other professionals sometimes in the field, the jargon, the clinical jargon and the language often gets in the way of the ability to communicate in a conversational, understandable fashion. Sure. Real challenge, or is it just in my mind?
No, it is, because I think that, primary care physicians and specialists have primary focus is to meet with the patients.
That's right.
And trying to get information to them to make their jobs easier is what we should be doing as an organization. And to try to make that data, not just providing data, but make it useful data, actionable data, which really helps them.
You keep talking about data. Is it number driven?
Some of it is clearly numbers driven. I mean, it's if we can at least provide a listing to doctors who are the patients that haven't had a BMI, their body mass index, or they haven't had an eye exam. Just giving that information so that they know that in the practices is helpful.
That's population health.
That's a part of it, yes.
In action.
Absolutely.
You had a knee replacement.
I did.
What is the connection between that and population health?
So, well, right now Medicare has a comprehensive joint replacement program where the government wants to fund, and they are funding, based on the outcome. So traditionally in the United States, everyone gets paid, and the physicians have been paid in hospitals, fee for service. So the more you do, the more you get paid. So the federal government says, we want to pay you on outcome. So what they say is, we're going to pay you for a knee replacement, but anything that happens for 90 days after that, we're not going to pay again. So if that patient gets readmitted or something happens, we're not going to pay them.
Then who pays for it?
The hospital does. The hospital is at risk.
Talk about the future of healthcare.
Yep.
The future of how healthcare is paid for is changing dramatically.
It absolutely is. So we need to work really diligently so that those individuals have a positive outcome. They don't get readmitted. And so for myself, I had a total knee replacement. And an example is that for post-acute services, after a person leaves the hospital, in New Jersey, about 70% of individuals have knees and hips go to skilled nursing facilities. Across the country, the average is about 29%.
Wow.
So it's not that people shouldn't go to skilled nursing facilities. The question is that care should be at the right place at the right time, right? And we need to make sure that they get the right care. And so for our organization, we're working with the orthopedic surgeons, with the primary care physicians, and we actually, in this program this past year, saved about $3.6 million because we were moving people out of skilled nursing facilities to home care. My own personal experience was that when I had my knee replaced, I went right home. The next day I went home, I had a nurse visit me at home. I had a physical therapist visit me at home. It was a better setting for me because, you can get other infections at skilled nursing facilities. It doesn't mean it's just that, you're not sick when you have a knee replaced.
Well, hold on. What I'm curious about this is, so say you go home, you have the exercises.
Yeah.
You're doing your exercise. You're diligent because you're a healthcare professional. You understand it. You have the nurse come in.
Yeah, the nurse comes in every day.
But if you, quote, don't rehab or don't get to where you need to be results, right? What I'm confused about is there could be a variety of factors that impact your progress. Why is that all in the hospital?
Why is everyone in the hospital?
Why is all that on the hospital? Like,
Well,
so that's what you did. Say someone else didn't do
Well,
the exercise. Say someone wasn't diligent, or
Sure.
dare I use the word compliant. How is it all
Well,
on everyone else but the patient?
That's how CMS Medicare has
CMS
structured the program.
is,
The
the
federal
Medicare,
agency
right.
that oversees Medicare.
They're the ones who pay.
They pay, and they said this is the program. And I think what it really is saying is that, you know, healthcare doesn't end at the hospital. Healthcare never really ends. It's what happens prior to someone going into the hospital, meaning how can we help them be healthier lives, individuals, what happens at the hospital, and then what happens after the person leaves the hospital. So whether it's a skilled nursing facility or home care or physical therapy or whatever care they might need or follow-up visits, it's really important that we bring all of those organizations, all of those care providers together and really manage that. And if we can do that, we expect the outcome to be better.
You know, Patrick, as you're talking, I'm thinking more and more the quote-unquote future of healthcare in our state, in the state of New Jersey, and the nation is going to rely more on patients, not just being more informed, which is why we're doing this, but also becoming more advocates for themselves.
They do need to. And, you know, for myself, I had said to the orthopedic surgeon, I want to go home the next day. And
You said that.
I said it. And he said, well, I'd like to have someone stay in the hospital for 3 days, and then we'll send you to a skilled nursing facility. And my comment was, you know, I'm not sick. I'm having a knee replaced. There's no reason why I can't go home. I actually wanted to go home the day the procedure was done, and the discussion was at least stay in for one night, and then we'll ship.
But that's
we'll send
you.
home. That's for me.
Who understands the system,
Correct.
who understands, I'm not going to say the politics, relationships, if
Yep.
you will. Give some advice to the average person watching right now.
Well, I think, you know, to your point, I think individuals need to become more advocates for their own care and what takes place. Now, conversely, my uncle, who is 72, was in the same pre-surgery meeting that I was at. He was 72 years old. He had both his knees replaced. He didn't go right home right away because, again, it depends on the individual and their specific circumstances, their other illnesses they may have, you know, prior to having knee surgery. But I think that it's a situation where everyone has to take responsibility for their own care and proactively work with the physicians, the nurses, the care coordinators, and do everything we can to improve the outcome.
Finally, population health and everything associated with it, not going away anytime soon.
I don't believe so. I think that
It's not the latest trend.
it's not a trend. It's you know, you talked about the financing of healthcare is changing. You know, the bottom line is the federal government, who is the biggest payer in the United States, wants to pay for the outcome. And so they want to pay for the results.
Is that also part of the Affordable Care Act?
It is. It's all wrapped in about the concept of really paying for performance.
Versus fee for service.
Versus fee for service.
Not going anywhere.
No, and it can only really be successful if the payers, the physicians, the hospitals, all the post-acute providers, everyone works together. And the patient work together to have a better outcome.
Patrick Young, one of the country's top experts when it comes to this very important field. Population health is more than a field. It's a lot more going on there. Population health at Hackensack Meridian Health. Good to see you, Patrick.
Thank you. It's great
Thanks, my
seeing
friend.
you.
Stay with us. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Russell Berry Foundation, Horizon Blue Cross Blue Shield of New Jersey, the Northward Center, New Jersey Resources, ADP, the Fidelco Group, and by Fedway Associates. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.